the public system doesn't have to advertise, hey, come to our hospital. You go to the one that's closest. The doctors don't advertise saying, hey, use me. They have community come to them. So private sector, for-profit organizations need to advertise, and so their costs are higher there. So marketing and advertising costs, and also they pay higher salaries for CEOs and administration. So it's very easy to see why costs are higher, and the evidence, if you look at studies of private for-profit versus public, show two things. One is, very clearly, they show costs are higher. And in the US, administrative costs are in the range of 15%. And that includes marketing, administration, and profit. They have to give at least a 4 to 5% return to their shareholders, if not more. So it's 15% or in that range, whereas in the public system, it's between 1.5 and 3. So, it's dramatically different in costs. So costs, obviously, Manning was totally off base on that. It will not do anything but increase costs. And outcomes, study after study has shown that mortality rates are higher in for-profit hospitals. You're more likely to die if you go for a surgery in a for-profit hospital than in a public hospital. Obviously, they need to cut corners to make a profit, and it shows in quality. Studies that have shown, that have looked at dialysis, that have looked at infant mortalities, that have looked at neonatal care, that have looked at other types of mortality in surgeries, consistently show that the quality is lower and the outcomes are worse. So that it seems to me that if the evidence is so strongly against for-profit in cost and outcomes, it is purely an ideological campaign. And that was evident when Ralph Klein said, in response to the Chuli case, he said, we have a legal obligation, which isn't actually true, but he said, and we also have a moral obligation. And I think that says it all. They feel a moral responsibility to introduce a broader market for private insurance companies to access here. And it's not about public health delivery. So that's sort of the ideology, and I think that we do need to talk more broadly about those issues and bring that evidence to light. The other area where there's a lot of ideology is the Europe sort of third way concept. And I say the only real thing we could learn from Europe is how to have siestas. I like that myself. But in healthcare, actually, we are ahead of almost all European countries on private involvement in healthcare. There's 2 ahead of us. One of you know for sure, the Americans. And the second is France, which has having real problems with access and costs in their system. If we go any further down that path, the only place we're going is the American model, not a European model. And they are completely incorrect in talking about private models in Europe being a path for us, because we have already passed them. So if we're going to look at European models, what we should be looking at in terms of health outcomes, and they do often have better health outcomes than us, but it's not because they have user fees or private insurance. It's because they have less poverty, less inequality, better social programs, cleaner environments, and we need to look at that context and say to the government, okay, to the Conservatives, if you want to talk Europe, let's talk Europe. But don't cherry pick one little piece and say that's going to reduce or increase our life expectancy, because it won't. If you want to increase our life expectancy, then let's talk about the context in which their health systems operate. The other thing that they have that we don't is broader public coverage, long-term care, continuing care, pharmaceutical coverage, very comprehensive, dental. So let's talk about that then. If they're going to bring up Europe consistently, though the purveyors of private healthcare do bring up Europe, if they are, then let's talk about progressive reform for healthcare based on European models. Let's have more, not less, public healthcare Let's have more social programs and government involvement in reducing inequality. Proportional representation is linked to health outcomes. Countries with proportional representation tend to have lower inequality, and lower inequality means better health outcomes. So those are some of the ways that we could take the health agenda that's being discussed right now and flip it a little bit over to a more progressive health agenda. So that moved us beyond ideology into looking at the facts. What does really affect health outcomes? What is the best, most effective health system? And the evidence clearly shows that Canada's public, taxpayer-funded system is the best in the world. It's almost unique, and it is the best in terms of cost and quality. If we are to improve it, the way to do so would be to increase the coverage, not introduce private delivery or insurance.